This time we'll be looking at an aortic dissection. We just finished looking at the aortic aneurysm, where all three layers, the intima, the media, and the adventitia, balloon out. But in this case, what's happening is we are seeing that a second lumen is being created as a result of a tear in the intima. If you look closely, you can see this is clear. What we see here is that we have a medial degeneration. This is because a tear in the tunica intima allows blood to dissect between the intima and the media, causing the problem. Now, the true incidence of the disease is unknown, but as for the signs and symptoms, there would be a sudden onset of sharp tearing pain radiating to the back, or sometimes it's to the chest, and there may be, any neurologic complaints associated with pain, syncope. This is obvious because the patient would be lightheaded due to a loss of blood, and there could be flash bradycardia, acute CHF, and other vague nonspecific symptoms. So how would you know whether they had an aortic dissection? Well, first, with an X-ray you would see a widening of the mediastinum, and then with a CT you could notice the double lumen. And as for the treatment strategies, they're similar to an aortic aneurysm. Medically, you would treat with morphine, anxiolytics, and afterload reduction and beta blockade. And the goal for the systolic blood pressure would be 100 to 110, and the goal for the heart rate would be 50 to 60, and then treat surgically if needed. So one of the sad things about this is that there is a 50% mortality rate, and even with surgical intervention there is a lot of troubles which would result in the death of the patient.